So guys, how are you? I hope you're doing fine. This is just a small video about things that you must not miss whenever you are taking any history of any female who's presenting with breast presentation. Okay, so things not to miss. Number one, explore the breast presentation, which is going to be, for example, breast mass. So explore it well. So make sure you ask which breast, what about the other breast, how many lumps, okay, any lumps anywhere else in your body. Make sure you assess, has she lost weight or not, okay, check weight loss, loss of appetite, okay, and make sure some point must not be missed there. Number one, things to grab your attention. Number one, mostly if the mass is painless. Number two, unexplained breast mass just came, no reason, I don't know, doctor. Number three, unexplained axillary mass when she's more than 30 years old, okay, it's more than 30, not more than 40. Nipple changes, any nipple changes, okay, any nipple changes, skin changes around the nipple, bleeding from the nipple, retraction of the nipple, changing the shape of the nipple. Make sure you ask about the risk factors of breast cancer. Risk factors of breast cancer are a lot, but let's just say the main things that the examiner would want to hear you saying them. Number one, family history of breast cancer. Family history of breast cancer, you need to know how many members in the family have had breast cancer in the past, okay? And you need to know, is it first degree, second degree, what degree in the family? You need to know one of the main factors, any male in the family who's diagnosed breast cancer. Number one, family history. Number two, lifestyle. Lifestyle, obese, high BMI, who smokes heavily, lack of exercise, alcohol, lifestyle. Lifestyle is one of the reasons. So family history number one, lifestyle number two. Number three, medication history, if they are on COCP or HRT. Number four, very important, if she has hit her period early menarche or late menopause. So early menarche, late menopause. Don't forget early menarche, late menopause. Whenever we find any red flags, out of this that we have mentioned, do not forget to examine the breast, and investigations to be done. It will be done in secondary care. So basically they will be referred for triple assessment. Triple meaning three. Triple assessment. They will need referral, urgent referral within 2 weeks to specialists who will further examine the breast, and they will further run investigations like what? Like mammogram and biopsy, and they will further manage the patient, okay? Make sure that patient, if you are in primary care, you offer her enough support. Make sure you offer her enough support, because if you are giving her suspected diagnosis of cancer, she will be mentally devastated, she will need support, and you need to make sure there is enough support at home.